Welcome back. So finding affordable medical insurance is an important component of your retirement planning, and once you reach age 65 and are eligible for Medicare, the costs go down, but the process becomes infinitely more complicated. My guest is Mark Munger, who practices in Omaha, Nebraska. Mark, again, thanks for joining us. Let's start out by talking about the four major parts of Medicare. What are they?
Oh, that's a great question. Medicare has four parts. Part A is your hospitalization coverage. That covers basically the hospital room and board, as well as skilled nursing facilities and a couple of other types of care. The most common type of Medicare coverage that people talk about is Medicare Part B. Part B covers your medical coverage. Medicare generally covers 80% of the medical costs that people incur, and the other 20% is covered either by the individual or is reinsured. We'll skip Part C. Part D is your drug coverage. Those are prescription coverage through private insurance companies. Those insurance companies have to have contracts with Medicare, and then the person purchases their Medicare Part D drug coverage through those private insurance companies. And finally, Part C. Part C is also known as Medicare Advantage Plan. And with Medicare Advantage plans, a private insurance company has a contract with Medicare to provide someone's Medicare insurance coverage for a calendar year from January 1st through December 31st.
Well, that is complicated. So, Mark, now talk about the eligibility requirements.
In order to be eligible for Medicare, generally someone has to be 65 years old and have worked for 40 quarters to be entitled to Medicare Part A. There are also individuals who qualify for Medicare after 24 months of disability and receiving Social Security through the disability program.
So what if somebody is eligible for Medicare but they're still working at age 65 and covered by an employer plan?
It depends on their employer, but generally they have the option to maintain their group plan through their employer and incur no late enrollment penalties through Medicare, as long as they have creditable coverage through that employer. Generally, Medicare will give you the opportunity to keep that coverage until you decide to retire and then enroll into Medicare Part A and B with no penalties.
So I guess finally, Mark, the big question is, how do you figure out which is the right plan for you?
The best advice I can give is to speak to Social Security, talk to a licensed life and health agent who deals with Medicare plans, and get as much advice as you can from those experts.
Great, Mark. Thank you so much.
Thank you, Scott.
He is Mark Munger. He practices in Omaha, Nebraska, and thank you for watching Retirement News Online.